Okay, today we're going to be talking about fall prevention. So when you are going to assess a patient for fall risk, your goal is that they have no falls and remain injury free. So when going into the patient's room, you want to obviously perform hand hygiene and don any PPE that's necessary for that client situation. You're going to talk about things you could do to eliminate falls, and allow the client and the family to communicate a little bit so that they could bring up any concerns or questions that they may have. Some things you can do for a patient that is high for a fall risk is obviously there's bracelets so that anybody entering that room knows that patient has a high risk of fall. You would keep the bed in a low position, utilize side rails, the top side rails, according to your facility's policy too. You could use floor mats for those that have fallen. You want to make sure that any walkways or pathways are free of any unnecessary equipment, to remind them that if they have IVs or any attachments like that, that they need to bring those with them. And then you could do non-skid socks. We could utilize alarm systems for the beds or wheelchairs. If there is a wheelchair being used, you could also put alarms on those, and then make sure when they're not in motion, keep those locked along with the bed being locked. You could also, make sure that there's no wires or anything on the ground covering those. You could talk to the care provider about initiating the proper physical therapy they could use, a cane or a walker that they could use, or any type of vitamin or medication that could help treat or prevent osteoporosis. And then go from there. I think that's pretty good amount.